Why is it so important for the SLP to be involved when PTs and OTs want to incorporate loud talking in therapy?
So it's great when I hear PTs and OTs cueing people to use a loud voice, especially when it's somebody that I've worked with before. And in my clinic, that's really how it works. The PTs and OTs that I work with will provide cues to people for loudness if they know that I've been working with them or we've talked about what appropriate cueing is. And it is important that the PT and OT do defer to the speech language pathologist about any recommendations for their voice, just based on our training and our clinical assessment of these people that have potentially voice problems. And we do know that it's possible that if someone is just using a loud voice, they could be using a bad quality or strained loud voice, which could be hyperfunctional and potentially causing some problems for that person. And we don't want to do that for anyone. We don't want to have anyone using a voice in a bad way and then creating another problem on top of that. So if someone does suspect that someone could benefit from speech pathology, let them know, wow, your voice sounds quiet. It's hard for me to hear you. Could you speak up louder if that's what you need? But then that's when you know to refer to speech language pathology. And if you don't have an SLP that you're working with, you could always reach back out to the neurology department or the neurologist that referred and see if they have someone that they could refer to. So it is important to have that assessment before giving cueing for loud.